The American Heart Association has their simple sevens, which are listed here, that talk about what can I do to reduce my risk. And there are 7 things that you can read, but you'll notice that I've put comments by each of them. Okay, I'm supposed to manage my blood pressure, but what's optimal and which drugs should I use? And controlling cholesterol, but what cholesterol test do I even look at? And what drugs are the best? Are all statins even alike? And blood sugar, well, if my blood sugar is normal, what if I have insulin resistance and because I have a normal fasting glucose, which is a whole lot of people. Getting active, yes, movement is medicine, but what should I do? Eat better? I mean, that's literally off of their website, eat better. What does that mean? And is there, and I already told you the answer to this, there's not one best food plan for everybody. We need better information to tell you what your eat better means. It says to lose weight, but is all body fat equally harmful? If you've watched this channel, you know it's that visceral fat, that fat around your midsection that's harmful, that's inflammatory. And stop smoking, absolutely. That's the number 2 cause of death. But what about other nicotines? Vaping, is that really bad? Is nicotine gum so bad? So again, standard of care is a starting point. Yes, these are all important bullet points, but you need a personalized precision recommendation. Oh, by the way, I just showed you the spider web. I just showed you their simple sevens, but what about those drivers of disease? Nothing's mentioned about sleep and oral health and stress management and genetics. This is a cartoon that the Bale-Deneen trained folks often use. I use this with my patients. The top of that tree is dying because of inflammation, and you can see plaque progressing from left to right, and it's all due to inflammation. So I have to find out the root cause of a patient's inflammation. And underneath all those different root causes are what we look for. This is what Ford has been talking about for years, all of these different factors. Well, on our next talk, we're going to summarize all of that and cover each of those with some important bullet points. Not only how do I find out do I have it, but what are some steps I can take now? And the Bale-Deneen method, and I'm a clinical coach with Bale-Deneen and help to mentor providers, is called EdFrog, where you educate yourself, and this audience is doing that. But don't stop with education. Find out if you have disease. Find out if you're on fire. Find out what your root causes are. Find out what your optimal goals need to be. Find out about your genetics. All of these are a part of figuring out what's up. And guess what? We'll also talk in part 3 about ways that you can start doing all of these things on your own. Because let's go back to the standard of care. Your doctor, for many reasons, is unable to provide this. They can provide great disease management, but they can't provide all of these things. So it's really in your court. You are the dominant force in your life. So find out if you have arterial disease. And you can look at old radiology reports for different clues. And get that carotid IMT scan or get a calcium scan. Get your aorta scan. You have to look for the disease, and if you have any evidence of thickening, let alone plaque, you got to figure out, okay, am I on fire? Do I have inflammation? What's driving this? What are my root causes? This is an overview of what you need to do to design a personalized prevention program. Because Abe Lincoln said it best, in the end, it's not the years in your life that count, it's the life in your years.